I got into osteopathy after I trained to be a nurse, actually. I then was almost going to study medicine, but wasn't quite sure about it. And in fact, I had a treatment myself for migraines at the time, and it just really resonated with me, the way the practitioner at that time was working and helped me with my own problems. And yeah, ever since I felt like that's what I was looking for, and that's how I ended up looking at osteopathy, and then looking at osteopathy in the UK specifically, because at the time that was definitely, and still is, probably the best place to study in Europe, and that's how I ended up studying osteopathy at the ESO. I only looked at two schools in the UK, and that was one of the London schools and the ESO. I did go through all the tests at the London school as well, and would have had a place, but as soon as I arrived in Boxley for my open day, I think that was the decision made. It's just such a beautiful place, and for me it just really felt like the right place to be, rather than in the centre of London. I think the ESO definitely has that strong point, that they do teach a lot of different types of osteopathy in an undergraduate level. So that will give you the tools to be able to treat babies straight away if you're interested in cranial work, or treat visceral problems, because we go through visceral techniques during our training as well. So it's massively helpful, and I think other schools don't do that so much. They put more focus on a very structural approach, and then obviously after students graduate you can then do special courses, but the ESO covers a lot of those techniques in an undergraduate level, which is wonderful, because then we can go out and feel confident treating, as I said, for example, babies or pregnant women. And that's definitely a big benefit studying at the ESO. All those years back when I was a student at the ESO, it wasn't set up in the same way, so we didn't have all these very specialized clinics as they are set up today. So I think the system there at the moment is wonderful, where you can choose to focus on the maternity or women's health clinics, headache clinics, sports clinics, and it again will just give students such a broad range of techniques and skills to look at various problems. And then obviously later on we can specialize more after we graduate, but again, it's a great benefit of the ESO and studying at the ESO to be able to already specialize a little bit more in an undergraduate level. Since graduating, I think for the first couple of years I didn't do too much, because there's still so much input, and it's also nice to let things settle for a little while. And then my interest was more in treating potentially babies and women pregnancy-related problems. So I've done more courses in the cranial field, and recently I've started doing a 2-year postgraduate course specializing in women's health. So that's, for me, was my kind of path. I feel there's a lot to be done in that area, and a lot of work where we can help women, especially in those slightly more difficult situations when they suffer with problems during pregnancy or postpartum or anything related to women's health. So that has been, for me, a special interest. So we were fortunate enough to take over a multidisciplinary clinic. Obviously it was a little bit of a shock as well, because I wasn't quite prepared for something as big, studying to be an osteopath and then all of a sudden running a clinic and having employees and kind of looking at all these things. But again, it has been a great opportunity for us, and we have a great team here. So we have different therapies that we can offer. We have acupuncture, osteopathy, reflexology, massage therapists. So we can really find the best way to help patients as well. Sometimes we will advise somebody to maybe have a bit of osteopathy and then a few sessions of acupuncture, just to make sure they get the most benefit out of their experience. I think for myself, I would like to really focus on the women's health. So at some point, maybe then just really trying to see mainly women and giving the time I have to those sort of problems. Obviously, it's still lovely to see anybody and have a big range of different patients that comes through the door. And I think I always will do that, obviously, as well. But for me personally, I'm very interested in this, and where I've put so much energy and time into studying this, I would like to take this further and specialize in this more. For me, summarizing the ESO, it has been life-changing. I've made amazing friendships that are lasting still today, and I've changed my complete outlook on health and how to approach this. And I've come away with a husband and a child as well, which has been facilitated through the ESO. For me, being an osteopath is an amazing privilege to work with people, to help people live a more fulfilled life. And yeah, I wouldn't want to change that job for anything else.